The following is an Operation Podcast production. For the focus of this episode, I really want to dive into the world of nose job, rhinoplasty. A lot of questions around it in terms of the physical aspect, the mental aspect, how young is too young, safety measures, concerns, all the above.
You know, those are concerns that I deal with every day in my practice, dealing with the patients. Their age, whether they're too young or they're too old, that's always the question.
What is the biggest myth you think there is about nose jobs out there today that you want to debunk?
Well, I think the myth of rhinoplasty or the myth of having the nose job, that somehow it's related to vanity. What I have found in my practice is that, hello, I'm Dr. Susan Chobanian, otherwise known as the Queen of Rhinoplasty, and I'm here at Ever Forward Radio. The youngest patient that I'll do is maybe 14. In my career, I don't like to do 14-year-olds. Medical literature says it's okay to operate on a 12-year-old, which I won't do. But in my career, I've operated on about a handful of 14-year-olds, and those patients were generally referred by a psychologist or a psychiatrist. The social pressure at school and in Los Angeles in general puts a lot of pressure on these children to look good. And I've done a handful of 14-year-olds. They've turned out well. The disadvantage of doing a 14-year-old is that the bones are soft and you may have to redo the nose later in life. Of the 6 or 7 14-year-olds that I've done, I've only had to redo one.
Amazing,
so I'm
Okay.
pleasantly surprised like that.
I want to dive into that age group specifically a little bit more in just a minute, but to kick things off, because I think a lot of people might be tuning in because they're curious about rhinoplasty, maybe getting a nose job, getting another nose job, or just learning the ins and outs, the telltale signs maybe of, did this person have one? Did they get one? Is it botched? Is it not? And I think there might be some confusion around nose jobs. So my first real question is, what is the biggest myth you think there is about nose jobs out there today that you want to debunk?
Well, I think the myth of rhinoplasty or the myth of having the nose job, that somehow it's related to vanity. What I have found in my practice is that, you know, patients come to me for rhinoplasty because they want to like what they see in the mirror. And it's not just vanity, it's about the patient's desire to succeed at any age, okay? And they want to be part of, you know, part of the normal realm of society. They want to be accepted as as an attractive person.
Fair,
I think that the fact that rhinoplasty is done simply for vanity or to look like someone else is wrong. I think the patients want to succeed. They want to improve themselves, and I've seen that in my practice. I mean, I've done, rhinoplasty. You know that the nose it identifies. It's an identifying characteristic of the face. Okay.
What do you mean by that?
Well, the nose is a characteristic on the face. It's the center of the face. When patients look at themselves in the mirror, they identify themselves by what they see, and the nose can represent. It represents not only their identity, it may also represent their ethnicity, and it also directs their desire or their position or what they want to achieve in life. I've done rhinoplasty on every walk of life, every ethnic group, okay? And you're not going to do the same rhinoplasty on a Las Vegas showgirl as you would on a Superior Court judge. And I've done both.
Even same ethnicity?
Even the same
age group, same sex?
Different, same group, same ethnicity. You'll do each one wants to achieve a different identity, and when they look in the mirror, okay, the nose is characteristic of the identity. The physical identity of the face is often defined by the nose because it's the center of the face.
So interesting. Okay, so two things come to mind for me here first. One, I had no idea, or I wouldn't think that when we look in the mirror, the most identifying characteristic we have to our identity or our sense of self, it's the nose. It's not the chin, it's not the cheeks, it's not the skin tone, it's not the complexion, it's not the eyes. You're saying most people actually go to the nose first to go, this is who I think I am. This is like the image of me that's going out into the world.
It's not the total image, but when they look in the mirror, if they're unhappy with what they see, okay? And in young patients, when they look at their face, that's what they'll look at first, is the nose.
The nose first.
The nose first.
Interesting.
Okay? And it's also, I mean, did you know that, you know, the nose as we have it on our, as humans, the nose that we have on our face, the bony pyramid of the nose is specific to the human species. If you think of it, none of the other animals have a nose that sits on the top of the face like a human being does. So it's a human characteristic. It represents our identity, okay? And in some cases, it may even, you know, it defines your ethnicity. And the goal is not to change the ethnicity, but to enhance it and make the patient comfortable what they see, what is looking back at them in the mirror. And it builds the patient's confidence. It makes them mentally stronger. And I've been in practice long enough. I've been in practice over 25 years. I mean, 80-90% of my practice is noses. 40% of all the noses I do are revision rhinoplasty. So I know if they get a nose job or they get a rhinoplasty they're not happy with, I know how they can ruin a teenager's confidence or a young person's confidence. And I've also seen a rhinoplasty really give the patient the confidence to succeed. And that is the greatest satisfaction that I've received in my practice is over the years, I'll get letters. And now that social media has become so popular, patients contact me that I operated on 15, 20 years ago, and they really relate the successes they've had in their lives.
That's incredible. That's incredible. I mean, it all kind of makes sense. Whatever we need that catalyst to be for us to really allow the version of ourselves that we feel deserves to be out there in public. For some people, apparently that's the nose. That's the origin place. Yeah. The other point I wanted to bring up was you bring up an interesting concept of, is there, you said a Vegas showgirl nose? Is there a congressman nose? Is there a podcaster's nose? Is there a nose, a typical nose for pretty much every genre, every profession, or kind of like generalities that people are going towards?
I don't think there's years ago there was. Okay, when I was first in practice, there was a model for Estee Lauder. Her name was Karen Graham, and everybody wanted a Karen Graham nose. But that has changed. Our society, the diversity of our society, the acceptance of diversity in our society has changed that concept. Okay, patients. I spend a lot of time and effort talking to the patient, going over their photographs, and making sure that they achieve the look, the presence that they want. Okay, and I've been in practice long enough, and I've done nose jobs long enough where I can practically predict my results. Okay, I draw it for them on the picture. They see how it looks on their face, and after surgery, I'll compare to see how close I came. All right, everybody wants something different, but you know, a Las Vegas showgirl or a model, depending on what kind of image they want to project, a softer, more feminine image, or is that a superior court judge or an attorney or a doctor who needs to walk into the room and assert their authority? Okay, and everyone has their own desires.
What does an authority nose look like?
An authority nose.
If I want to walk in the room and everyone just go, man, that is one authoritative nose.
No,
what does that look like?
It has to fit the patient's face. Okay, if an authoritative nose has an authoritative face, the patient will walk in with a serious demeanor and a serious look. and they want to be taken seriously. Okay, a patient who wants to be cute and soft and feminine, that's a different look.
Like a small button nose.
They're all feminine. They're all female noses. But that's the thing about female noses. There's usually a lot of variation. Male noses are really more straightforward. They're actually easier for me to do because most men want the classic Roman nose, a straight bridge, a straight tip, an angular tip.
We're still obsessed with the Roman Empire. Even when it comes down to the
they
nose.
Want the Roman nose. Yeah, they want the Roman nose. Okay, but like I said, as our society has become so very diverse, as our society has accepted and promotes diversity, okay, so has rhinoplasty evolved.
I cannot agree more. And I even, as you describe this, I'm beginning to kind of just think about other areas where I've seen this. And I'm not, in the world nearly as much as you are, but I've even seen people go in for dental cosmetic surgeries to get the gap tooth. Like that used to be something I know a lot of people would get fixed because it wasn't, societally, society didn't like smile upon it, pun intended. But now people are finding it's cute and endearing, and we're kind of like more supportive of differences.
Arnold Schwarzenegger, he got famous on it, and he still got the gap between his teeth.
Yeah, that's very true. That's very true.
Very handsome man. Yeah.
Rhinoplasty is still one of the most searched cosmetic procedures. When we're looking at plastic surgery, it's the nose job. So I'm curious, as someone who's been in it now for several decades, how do you think the approach has changed, or has it in the last decade?
Well, as I said, I think the approach has changed because everybody wants something different. And everybody, we accept the diversity and we want to work within that ethnicity. We want to preserve it. We don't want to change it. Okay, like I said, when I was first in practice, everybody wanted one style model's nose. Everybody came in and asked for the same thing. And we were, and honestly, I've been in practice long enough. Those noses that I did 20 years ago, now they come in and they want them redone because they wanted to make it look
because
so-called
that
style went out of
style.
Now it's not a matter of style. Now it's a matter of enhancing whatever you have to make you look more confident so that you can succeed in life, whether it be professionally or socially or emotionally.
So would you say it's almost as if diversity and inclusion has found its way into cosmetics as well, into rhinoplasty?
Definitely. And like I said, like rhinoplasty, when patients look in the mirror, and they actually did studies on this, and they found that, if you look back in the literature, in the medical literature of facial aesthetics, they actually, patients actually define their identity by their nose.
Wow. It's so interesting. I would have gone with other areas maybe first. People weren't as happy with, I've got big ears, my ears stick out, or I don't like my frown lines. It's just wild to me that people immediately go to the nose still.
Well, it's been studied. Yeah.
My smile.
Yes, those are it's the icing on the cake. I think the ears, the chin, the jawline, the eyelids, all right, those two are sort of, hereditary characteristics, how your ears are, how your jawline is, and we enhance those too. But the great majority of patients will come in, or my patients come in, okay, and their focus is on the nose.
Would you say a nose job changes the overall face the most compared to if someone gets a chin implant or filler, or is that the thing that if we just do that one thing, that is going to change the overall appearance the most of the face? So therefore, maybe the other things aren't as important.
You can do a million facelifts on a woman. If she's got a droopy nose, she's going to look old. If you have a 15-year-old with a droopy nose, she looks old. If you change the nose, you've already rejuvenated the face.
Change the nose, change the face.
Change the nose, change the face. Okay, and that's sort of an aesthetic trick that we use when patients come for facelifts. If a woman, she wants a facelift, fine, I understand that. Okay, but if I see that she has a droopy nose, I says, you know what? Why don't we just rotate the tip? Okay, elevate the tip a little bit. We don't have to do the whole nose, but elevate the tip so that, and sure enough, that opens up the whole face.
Fascinating.
It's an augment to the facelift, or is the facelift an augment to the nose?
Interesting. Okay, so now I want to get into a couple of different types of rhinoplasty. Can you break down for us, please, the difference between open and closed rhinoplasty, and how do you choose which is best?
You know, I know how to do both. Okay, on young patients, where if it's a primary rhinoplasty, I really choose
Meaning
to do
it's their
closed.
first-
Yeah,
their
the
first
first
nose job, okay.
rhinoplasty. If it's and it's a teenager, you know, it really kills me to put a scar on the outside of the face. Okay, I watch TV, I look in the magazines, and I can spot an open rhinoplasty on TV. Okay?
Sorry, can you also maybe go back a step? Can you describe for us, please, what is an open rhinoplasty and what is a closed rhinoplasty?
Oh, a closed rhinoplasty is a rhinoplasty that's done through the nostrils. All the incisions are made on the inside of the nose, and the functional and the cosmetic portion of the rhinoplasty will be done without any scars on the outside of the nose. It's a scarless rhinoplasty. Okay, and
Wouldn't everybody
scarless-
want that?
Huh?
Wouldn't everybody want that?
Well, you know, that's the way I think. All right, but closed rhinoplasty has actually become a lost art because the medical schools and the training programs teach open rhinoplasty because they feel that this surgeon can actually be more accurate. An open rhinoplasty is where you put a scar across the outside of the nose here in the columella. You take the incision inside the nose, and actually what you do is you peel the nose back.
I remember
Okay.
in preparation for this interview
You
looking up
peel
some
the
clips
skin
like
out.
this. It's some wild procedures.
It's
It's wild.
And then you know the approach to rhinoplasty is that it's, you know, I prefer a closed rhinoplasty. Open rhinoplasty I can do if it's a revision rhinoplasty that's been done like 2, 3, 4 times and I'm looking at number 5. I might do an open, okay? But I prefer to do closed. And I have I prefer to do closed, especially on young people, especially on beautiful young teenage girls. I hate to put a scar on the outside of the nose. I do a closed rhinoplasty, all from the inside, and I believe that I get less swelling, less bruising, and I believe that the skin and the nose heals faster,
Okay.
Not only that, but in patients, certain ethnic groups that have very Mediterranean type skin, thick skin, somewhat oily skin, sometimes when you do an open rhinoplasty, you can, you know, I've seen it where the swelling in the nasal tip like just never goes away.
So am I hearing you
well,
correctly that one skin type, in terms of oiliness, dryness, complexion even, is a prime driving force to the best type of rhinoplasty for that person?
Yeah, I really believe you may find doctors who disagree with me, but I really believe that a patient who has thick, oily, sebaceous skin, Mediterranean type skin, okay, they will heal better and I can get a better result, okay, with a closed rhinoplasty because I haven't violated the skin of the nose as much. And I really believe that it forms less scar tissue.
Interesting.
Okay? Patients who have Mediterranean type skin have a tendency to form thick scar tissue. And if you do closed, it's a more delicate technique. It's technically more difficult. I mean, I'm working through 2 little nostrils in order to take off a huge hump, narrow the bones, and reshape the cartilages of the tip. Okay, but in the long run, I think the patients heal better. I think that they heal faster, and I think it ultimately forms less scar tissue.
Okay.
And I believe that in my hands, closed rhinoplasty is a much faster technique. Okay, a closed rhinoplasty, from skin to skin, from the time I make the first incision until the time I put the bandage on the nose, the average time for my rhinoplasty is 1 hour and 20 minutes.
Wow.
Okay,
A whole nose job in less than an hour.
but I have done revisions And I have a whole series of revision rhinoplasties that were previously done by an open technique, and I revised them with a closed technique. In fact, I have one coming up tomorrow. It's a young girl. She's in her late teens, early 20s. It was done by an open rhinoplasty someplace else. She's unhappy with the result. And the poor child, I mean, you know, her confidence is down. And she, you know, they went all over town. A lot of doctors didn't even want to do the revision, okay? And when I told that, and they had seen other work that I had done from other patients. When they came and I said, yeah, I can revise this through a closed technique. I don't have to open that scar again. The mother was very happy. So I'm going to do that case tomorrow.
All right.
And I'll let you know how it turns out.
Amazing.
I'll send you the before and after pictures.
Yeah, you mentioned that your preference is to go closed.
In fact, yeah.
More so after several revisions,
I prefer to do a closed rhinoplasty. I really think it's a lost art. Okay, open rhinoplasty, I mean, you know, you make a bigger incision. You basically skin the nose, okay? And you're looking straight down on all the anatomy of the nose. And, you know, from that standpoint, it's technically easier. It's harder to do it when you're working through two little nostrils, okay?
Sure.
The lighting, the access. But I was trained to do it that way, and I've been doing it that way for my entire career. And I know how to do open rhinoplasty on a very severe fracture, on a very severe revision. I might do an open, okay? But by and large, I do closed rhinoplasty, a scarless rhinoplasty without any scars on the outside of the face. And so far in my career, it's served me very well. I mean, I've done, you know, I do a lot of noses. And I have a series of probably over 1,000 of revision rhinoplasties that were done by an open technique, and I revised them with a closed technique, okay? Revisions are always more difficult, and a lot of the revisions I get, you know, have been done more than once. They've been done once, they've been twice, they've been three, they've been done done in Iran, they've been done in Moscow, they've been done in New York, and then all of a sudden they come to California.
First, right? Yeah, that's people go out of the country for things, and then they need to get another one and another one.
I just got a phone call this morning. I had my nose. When can I have my nose redone? Well, when was it done? It was done about 6-8 months ago. Where was it done? It was done in Armenia. They come, they don't like it. They're calling me on the phone. When can I have this redone? And I said, well, come on in. Let me take a look at it. So I get those phone calls. I mean, I've done revisions from all over the world. I mean, from Iran, from England, from Dubai, from Emirates. I mean, from Moscow.
Which country, in your opinion, botches the most nose jobs? Which country do you see people going to first, and then you're just waiting to do the revision?
Well, I think that's an unfair question, because I think some of these countries have some very competent doctors. I've seen some very good, acceptable nose jobs from some of these countries, but you have to understand that these countries don't have the same standards of education. And they don't have the same practice standards in terms of operating room and anesthesia. And I think that contributes to some results that are not as good. Years ago, I was getting revisions from Mexico, and the surgery was done by he wasn't even a doctor in Mexico. He was a pharmacist.
No.
And he was doing plastic cosmetic surgery, and he was doing nose jobs, and it wasn't just the nose jobs that I got, I forget his name.
Is that legal in Mexico?
In Mexico, at that time, there were no regulations. There
So
were the regulation.
any type of doctor
it wasn't
could
regulated.
perform.
It was, and patients came to me with his brochures. Where did you have this done? I had it done in Mexico. Who did it? Well, they showed me the brochure. And when I looked at the man's qualifications, he was not a doctor. He was a pharmacist. He had a pharmacy license. Okay, so in Mexico, I don't know how that happened. I don't know what the regulations were at that time. I've never practiced in Mexico, okay, but I've seen cases that have been done there. Okay.
Which country do you think does the best job of round one primary rhinoplasties?
Well, the United States.
All right.
The United States.
All right.
Okay.
But we still botch it up, don't we? I mean, there's a whole TV show about it, and they're
There's a
typically
whole-
coming from American
the-
doctors.
There's a TV show about it.
What makes for a botched nose job? What is the biggest thing a doctor does wrong when doing a nose job that then requires a revision?
Most of the revisions I see, I can't say that, most of the doctors in the United States are qualified, okay? They do the rhinoplasty, but for whatever reason, the patient is unhappy with the results. They're unhappy with the cosmetic or the functional result of the nose. And I can't say that the doctor did anything. I saw one recently. I can't say that the doctor did anything wrong. It's just that you're only as good of a rhinoplasty surgeon as the amount of techniques, as the multitude of techniques that you have between the ears. When I walk into the operating room, it's not in a textbook. It's not in a medical article. Okay, it's between my ears and it's at the tips of my fingers. And either the doctor didn't use the technique to achieve that result on that particular nose. I'll use a completely different technique on an African American nose or a Mediterranean type nose as I would on a Northern European nose or a British nose. The rhinoplasty surgeon is only as good as the number of techniques that he or she has between the ears.
So
it's
how do
got
they
to be in your mind
How do
when
they
you
foster
walk
more
into the
techniques
OR.
then? Is it just through repetition? Is it through who they train under, where they went to school, or even ingenuity and creativity?
Okay, it's both. It's both. Okay, it's your knowledge. Okay, patients today, it's your knowledge, it's your experience. I was first known as the cartilage queen.
The cartilage queen.
Because I can reshape the cartilages of the tip very well.
Huh.
I can take a bulbous nose and make it very thin. And even on a thick-skinned patient. It's because over the course of years, I know the basic techniques, but then I've personalized the variation on that technique in order to achieve the result that patient wants. It's not what I want. It's what the patient wants. Okay, so you have to deliver the results. I mean, like I said, you have to have it between the ears and at the tips of your fingers when you walk into the operating room. And once I open the nose up, I get a feel for exactly what type of cartilage. Some patients have weak cartilage, some have strong. Some cartilages are irregular or bent. You have to know how to straighten these out, and then you have to work with the bone. I mean, technically, rhinoplasty is actually listed under orthopedic surgery because you're dealing with bone.
Yeah, of course, yeah.
Okay, so I mean, I can't say that there's the vast majority of revisions I see. I can't say that the doctor did anything wrong. It's just that the techniques he used didn't deliver the result that patient wanted. Okay, I saw one patient. Now I thought that was very poorly done because the doctor not only cut the nose from the outside, but he took segments of the nose out. And this poor patient was walking around with a mask after COVID. And when he took the mask, I mean, I will do, there's very few noses that I will refuse to do. But when I saw this one, I know what it needed.
The mask affected the healing process.
He
and the
wore
shape
the mask to hide his nose because it was so poorly done.
bad.
Now that one was poorly done.
Not because of COVID. Just
Not because of COVID.
A bad nose
after
job.
COVID, this nose job was so terrible. I mean, it looked like his nose had been amputated, okay? And what happens is I know how this nose needs to be fixed. However, in my private practice in Glendale, California, I don't have, in case the healing process doesn't go 100% the way I want it to go, I don't have the ancillary services at my fingertips, like ion therapy and hyperbaric oxygen therapy, they may need to make that tissue survive. Okay, so I sent him to UCLA. I don't know what happened, but he went to television Botched, and I heard, I don't know, I'm not, I didn't hear directly from him, but I heard through the grapevine that even Botched turned him down.
Wow. Actually, Dr. Trudeau's coming on the show soon.
Yeah.
Yeah. So maybe I'll have to bring that one up.
Yeah, yeah. I don't know what.
Which ones you turned down?
Yeah, I know. That was one I turned down. But a revision rhinoplasty, most of the time I'll do it, and I'll do it. And like I said, I have a series. Like I said, in most of the time in this country, the revisions that I see, even the ones that come from other countries, I can't say that anything was done wrong, but the patients, whatever technique that doctor used to do that nose, never, just didn't deliver the results they wanted. The other thing I think is, I grew up in Wisconsin. I grew up in the Midwest. And most of the patients, even when I go back there today to visit my relatives, most of the people walking around on the streets have noses that don't need to be done. And I grew up there. I grew up in Wisconsin, as a baby. And I grew up looking at beautiful noses. Okay, they were at that time. Okay, the population was mostly Northern European, and of course, Northern Europeans have a variation on different types of noses, but each nose was beautiful in its own right. And even when I go back there today, I see these people that I know, and I can't find a nose that needs to be done. So my sense of aesthetics is there, all right? Whereas people who've grown up in other countries have a different sense of aesthetics. And then my sense of aesthetic is also American.
Makes sense, yeah.
It's American because I'm born and raised in this country, as were my parents, okay? So, I think that has a lot to do with it. I think a lot of doctors walk into the operating room and they don't know what's going to look good on that patient. When I look at a patient, they come to me for a nose job. I take one look at them, and in my mind, I see what I want to do for them.
Yeah, how do you really manage expectations there and manage vision? Because I have to imagine someone coming in for a nose job, they have an idea of what they want it to look like, but then maybe when they sit down in front of the expert, you might have a different vision. So what happens when those visions don't align, and how do you navigate expectations for going, hey, I know you want a nose job, but this is what you want, but this is what I really am recommending?
Yeah. Well, I always try to guide the patient. I mean, honestly, the Los Angeles society, the young people here, they know what looks good on them. I'm absolutely amazed. I mean, I'll talk to and I
They're not like delusional
them.
about these changes.
No. Part of my consultation is just that. I tell them the patients know. They come, especially the girls, they come prepared. And I tell them, bring anywhere between 3 to 5 different pictures of noses you really love. Don't worry whether it's going to look good on you or not. Let me know what you want. Okay. Now, very few patients are really off the wall. Okay. I mean, yeah, sure. I had one guy walked in my office. He said, "I want a nose like Michael Jackson." I said, "Wait a minute."
People want a Michael Jackson nose?
Well, like I said, that guy was unreasonable, and he was a boy on top of it. So I said, "Wait a minute. I don't think that I don't think I want to do. If that's what you really want, I don't think I can deliver that."
Unless he's going to be a Michael Jackson impersonator.
And I said, "I don't want to deliver that. Okay, I don't want my name on that one." Okay, but most of the patients, especially the young women, they come in with pictures and they know what looks good on them. Occasionally, I have to guide them, and I do it. And if they're persistent, if they'll say, "No, this is what I really want. I know it looks artificial. I know it looks phony, and I know it may not fit my face, but this is what I want to look. This is what I want." So I can deliver. I do it. I don't like it. Okay, but I do it. My goal is to make that patient succeed. Okay, if that's what's going to make her succeed, okay, it's really not my taste, it's hers. But 99% of the patients are accurate, okay, especially in Los Angeles, especially the younger women.
Accurate in terms of coming in with realistic
accurate in knowing
expectations.
what they want, yeah, and what looks good on them.
That's very surprising.
No, they bring in they'll bring in pictures that they found on the internet, and sure, the slope of the forehead, the height of the cheekbone, the length of the face, the length of the midface will match theirs. And they'll say, and they'll bring in 5 different pictures, and we'll try to pick the best characteristics of each nose that fits it. I'll draw it for them on their picture. They see how they like it on their face. I draw it. I don't use the computer. The computer doesn't do the surgery. I do the surgery. I draw the picture, and when I'm drawing the picture, I get an idea of where the difficulty is going to be in that nose. I can tell. And then we keep that drawing in their file, and after surgery, we'll compare to see how close I came. And I can come very close to that. I'm pretty accurate.
No doubt.
Pretty accurate.
Is there ever any instance where, excuse me, someone comes to you for just purely medical purposes? Like, I have a deviated septum, I had a injury, and I just want my nose to be fixed for just regular medical, normal health purposes, not necessarily looking for a revision, but I have to imagine when you're going to town on the nose, even despite the purpose, it's going to look different afterwards. So how do you navigate just a purely medical nose job?
No,
not an aesthetic focus one.
There's a percentage of my population that will come to me purely for functional reasons, meaning that they can't breathe well out of their nose.
Like, I want to breathe. I don't want my nose to look different.
That's right. I can fix the breathing without changing the outside of the nose. That can be done, 100%, no doubt.
We might have to talk then.
Okay.
Yeah.
And I have patients who have been elsewhere, for what we call septoplasty, nasal septal reconstructions, and they still can't breathe. Or they had it done years ago, and now all of a sudden they can't breathe again. Cartilage has memory. It likes to go back to the way it is. If you bend your ear forward and let go, it's not going to stay forward. It's going to snap back to its original position. So cartilage has memory. It likes to stay where it was originally, and you have to break that memory in order to improve the breathing and fix the septum. And I also do revision septoplasties. Okay,
What's
so
that?
That's where a patient has had, for just functional reasons, they've had functional surgery before in the past, and for some reason, it didn't do it. It either over the course of years it got worse again, or it didn't solve the problem. They come to me, I look at it. If I feel that I can improve it, I'll redo it. And revision septoplasties are technically more difficult also, because you're working only in the inside of the nose, and it's been scarred, and it's malpositioned. So you have to reposition it, make both airways open.
Makes total sense. I would love, breathing out of both sides of your nose is a great goal, I think, for anybody. You brought up, the whole cartilage issue before, and I know there's really nothing we can directly do, or correct me if I'm wrong, about supporting healthier or even more cartilage. But I'm curious, is there something we can do to really make us a stronger candidate to have the best success rate possible before a rhinoplasty? Is there particular things we need to add or subtract in our food? Or are there any exercises or massaging, or what can be done, if anything, to really
before surgery,
get you ready?
It's patients with a healthy lifestyle, non-smokers who exercise, who have a healthy diet, they don't eat a lot of junk food, they obviously heal better. They get less bruising, less bleeding, less swelling, and they heal a lot faster. So a healthy lifestyle is very important for the patient's recovery. All right, and especially for older patients. Okay, I mean, facelift patients, you want them to heal. The facelift patients who are non-smokers, non-diabetics, non-hypertensive, exercise, they have BMI 25, 26, good BMI, they do well,
Now, is this unique to rhinoplasty, or just because, any surgery going into the healthier, the better?
Yeah, you're right. But the cosmetic surgery that I do, and even The fat grafting. Okay, we do fat grafting to the face for contour deformities and for age lines and things like that. Patients who have a healthy lifestyle, who don't eat, processed foods, who don't smoke, who are not diabetic. If they're diabetic, if their blood sugars are under control, they do very well. They do very well. I'm always leery of patients, hypertensive diabetics that smoke.
Okay. I was going to ask you directly, what's the biggest red flag you see with people that make you go, because of this, we can't do a rhinoplasty, or until this gets corrected or changed or improved, we can't do a nose job?
Well, and yeah, I don't, heavy smokers, okay?
Why smoking?
Smoking causes chronic inflammation of the nasal and oral airways, okay? And those patients characteristically will bleed more, they'll swell more, they'll bruise more. Smokers in general, for any surgery, have 25% increased incidence of any and all complications, any and all.
So you're 1 in 4 more times likely to have a serious complication.
They'll get it, and not only that, but the smokers, the first line of immunologic defense in the mucous membrane of the nose and mouth is IgA. IgA is the immunoglobulin that attacks any bacteria that enters the nose or mouth, and it's in the saliva. Did you know that smokers have something like 25 to 30% less IgA in their saliva? So their immune system, whatever they're inhaling, and I see it in my practice. I mean, smokers come in, they'll have, if there's an infection going on, they're the first one to get it. If there's some kind of virus in the air, they're the first one to get sick. Okay, and it'll be a more difficult infection to clear up.
Do you see people actually really quitting smoking before a rhinoplasty, before surgery, or is it just like they tell you one thing and they're actually doing another?
No,
how do you actually know that that's no longer the case?
Well, it's hard. It's not like a drug test for smoking. Okay, you don't have an absolute test, but I can smell it.
Oh, sure.
Okay,
Yeah,
when the patients come in,
Yeah.
I have a very acute sense of smell. I mean, they say they're not smoking. They spray themselves with all sorts of cologne and mouthwash, but it comes out of the pores. I can smell it. Okay, I mean, if I can scare the patient enough, they'll stop smoking. Okay, and if I refuse to do the surgery unless they stop, they'll stop.
How
smoking.
bad do you really want it?
How bad?
Exactly.
Do you really want
Yeah.
it?
Okay. So you kind of already touched on this, but I want to ask you directly, getting into the teens and early 20s here, what's your take on younger patients seeking rhinoplasty, and what factors do you consider in their candidacy?
Well, for girls, I usually start doing rhinoplasty on girls at 15 and a half if they've started their menstrual cycle, okay? Females should have had their menstrual cycle, have a pretty regular menstrual cycle. Once the hormone levels are high enough to initiate a menstrual cycle, the epiphyseal plates or the growth plates in the bones will close, and then you know that it's safe to do a rhinoplasty. And you'll know that it's safe that if you do one rhinoplasty, that will last them for their entire life.
Wow.
Okay. Like I said, I've done a handful of 14-year-olds. Some of them started their period very early, cut a little bit, and the bones are soft, okay, and they like to go back to their original position. And then years later, you're gonna find yourself redoing that nose, okay? But that's the general rule of thumb that I use for girls. 15 and a half, must have started a menstrual cycle and have a fairly normal, regular cycle. For boys, military records, and you were in the military records show that boys will continue to grow up to the age of 23. Okay, so on a boy, I don't like to do a rhinoplasty unless they're 17 or 18 years old.
No, does the military record really matter most
No,
here?
the military record doesn't
military
matter.
service or without?
No, I'm not talking about military service. What I'm saying is that the military has actually studied the growth of men.
Oh, so we just have data from military males.
If a young man enlisted when he was 18, when he got out of high school, okay, and he served 2-3 years, the physical exam they did when he was discharged shows that he grew.
I got to check my records.
And
I enlisted at 17.
And
yeah.
that study was done by the military. It's a medical study that was actually done by the military that showed that men will continue to grow up until the age of 23.
So men should not get a nose job until after the age of 23.
No, what I'm saying is that some men will continue to grow until their age of 23. The safe age to do a rhinoplasty on a boy is 17 or 18 years old, because then most of the bone growth will have gone, will have be complete. Boys grow later than girls. Okay, their growth spurt is later in life, but the military has done records. The medical research that was done from military records reveals that some boys will continue to grow until the age of 23. And if they come to me and the mother says, he's still growing, then I would tell them to wait. But if he's 17, 18, and his height has been stable for the past year and a half, 6 months, then it's safe to operate.
So for guys, for boys, it's okay to get a nose job between 17 and 18, but maybe even just watching up to the age of 23 until you have how long of a period of time without any height change?
To be honest with you, most boys by the age of 19 to 20, they've stopped growing. Okay. But like I said, the military records have shown that some men will continue to grow up until the age of 23.
The military will actually, at least when I was in, they will give you one elective surgery. I knew service. I served with men and women that got rhinoplasties, breast augmentations. The elective surgery I went for was laser corrective surgery. I had PRK. It's kind of like LASIK, but we jump out of planes and stuff, and so they actually sand down the cornea flap and then do the laser procedure instead of cutting the cornea open, because at like high velocity and stuff, like the cornea can actually flip back open, which you don't want. So I was wild. I would see people go on medical leave. I'm like, what happened? And then they would have big nose padding on, or so the military must be tracking a lot of stuff like this.
I trained at the Veterans Administration Hospital in Wisconsin, and that was the largest VA hospital in the Midwest. And when I trained at the VA hospital, I did facelifts. I did breast augmentations.
Wow.
Because these people these veterans were entitled, or if they were active military, they were entitled to the elective surgery.
How many people are listening now and considering enlisting? They're like, maybe it's worth getting that free nose job. I don't know, just go serve with Uncle Sam for a couple years.
I saw a nose job that was done in an Air Force base hospital in Japan. Okay. And it was done twice there on a military wife. And I wound up doing the revision.
So a third procedure.
Yeah. And now he's stationed in Florida somewhere.
So she's throwing shade at all the military doctors, which I can honestly get behind, because it's a gamble. I had both my hips reconstructed by a military orthopedist during some injuries, and I'm now needing to get them redone.
Oh,
yeah.
Well.
Yeah.
I want well.
So it's free surgery, but you're going to pay for it later in one way or another.
Well, you have to, it's like anything else. Yeah. You have to know what
I will say this, my vision is still great. I still have the PRK surgery served me well, and it's been, that was probably 18 years ago. I still got like 20/17 vision. Yeah. So maybe just the eyes. Everything else, maybe let a civilian doctor handle. We'll see.
I don't
know. And I want to go back to kind of the youth rhinoplasty. I'm curious, is it more so the teenager, the adolescent coming in and wanting this, or the parental influence? How do you kind of navigate if maybe the parent and the kid aren't on the same page? Because they have to both be, right? Don't you need parental consent for something like this to happen? How do you navigate expectations between the patient, who is the child, and then the parent, who is, the guardian, the authority, the one paying for it?
Well, in Los Angeles, let me tell you, the kids win. Okay. Okay. We
I mean, they get what they want.
In Los Angeles. Okay, the kids win. Okay, I always am a neutral party. The parent comes with the child for the consultation. I do the consultation, and I try to be very objective about it. All right. And if the patient is underage, if they're under 18, okay, and even if they're over 18, I mean, the parents are going to pay, right? Okay, the parents control the purse. So the parents, if they want to put their foot down, they can. All right. I'm very objective about that. Sometimes the parents come with the child. They come in my office and they start quarreling. And I say, you know what? I'm here. I'll do the consultation. Let me address the child as a patient. Let me address her concerns. So then please don't make any decisions today. Don't book any surgery today. You go home, discuss it with your family in private, and when you've made a decision, call me. Okay? I think it's very difficult for any patient, whether the parents are in agreement or disagreement. I think it's difficult for any patient to make a decision in one consultation. And I usually see the patients at least twice before we decide to operate. And I usually go over the pictures twice, so I know exactly what they want before I go into the operating room to deliver it. Okay? In Los Angeles, we have a certain set of parents that are trying to promote their children. They think they're being good parents, and they try to encourage their patients.
I know
or
what
push
my
their
kid needs. I know best.
And I'll tell you a
And
story.
they have their own agenda.
I did a nose job on a 17-year-old, and the mother dictated what kind of nose it was going to be and when it was going to be done and how it was supposed to look. And the poor child sat there. She didn't say anything. I said, "Is this what you want?" And she just went along and agreed with her mother. She was 17 years old. Okay. 5 years later, she came back to me. After she had graduated from college, she was 23, 24 years old. And she said, "I want my nose redone." And I said, "Why?" I pulled out the pictures. I said, "This is what I drew. This is what you got. You got exactly what you wanted." And this girl turned to me and she said, this young woman turned to me and she said, "That was the nose my mother wanted. Now I've got a job. Yeah. I'm working. I'm going to get the nose that I want." So that taught me a lesson. Okay, that taught me that I should listen to the patient. Okay, and the parents can put their input, but I'll step in and I'll tell them. I said, if this child doesn't get what she wants or he wants, okay, their confidence is going to be ruined. Their confidence is going to be diminished. They're not going to get what they want. They're going to be unhappy, and they may not succeed at what they want to succeed in. And I said, as a parent, do you want them? What do you want as a parent?
And you're also introducing the potential for future harm. I have to imagine, let's say that young girl, right? She's going, yeah, whatever my mom wants, I'll do it. It's fine. So she's subjecting herself to a very invasive procedure, going under anesthesia, going under the blade always has potential danger. But in her mind, she's probably going, if I don't like it, if I don't want it, or later on when I'm an adult and have my own money and my own time, I'll just get it redone. So then we're introducing the concept of a potential unnecessary second procedure, that there's something that could go wrong, right? So there has to be kind of like an introduction of, ideally we just want to do one, because the less times we go under anesthesia unnecessarily, the less times we go under the blade unnecessarily, the better in general, correct?
Exactly. I mean, I don't like to do a nose more than once, okay? If I can satisfy the patient, I make them happy the first time around. If the parents intervene, okay, then, they're putting a wrench in the system, okay? Any surgery is a risk. No surgery is a minor surgery. I've operated on thousands of people's children, daughters, sons, husbands, wives. I never take surgery for granted, okay? For me, the operating room is a sacred place. And it's my favorite place. My favorite place to be is in the operating room, because when I walk in, no one disturbs me, no one touches me, and I'm in control. So I don't take anything for granted. There's no surgery, and
That's what you want in a surgeon. Yeah, I'm glad to hear it.
and I'm very proud to say, and I'm very flattered to say that I've operated on a lot of doctors' children. I just did twin girls. Their father is a doctor.
They both wanted a rhinoplasty, needed a rhinoplasty?
Both of them, they're twins, and they both wanted rhinoplasty. And you want to know this one? I did their mother's nose, and I did their father's nose.
This is like a family deal?
Before the mother and father got married.
No way.
Yes.
No way.
Yes.
Matchmaker, one nose at a time.
Yes.
I'm curious, with the twins, was it one wanted a nose job and the other one's like, well, now we're going to not look alike, so I have to kind of thing?
No. I've done about 6 sets of identical twins in my career, okay? And these 2 were twins, but they really didn't look identical, but they still wanted the same kind of nose. When you do identical twins, that's publishable too, because identical twins are mirror images of one another.
Even when you're getting down under the skin doing a rhinoplasty?
Because you understand how a twin forms. It's the zygote that splits down the middle, so the 2 are mirror images. So if one of them has a septal deviation or the nose is crooked to the right, the other one is going to have the nose crooked to the left because they're looking at one another.
Oh, wow. Always? That's always the case?
So
wow.
when you do twins, you do one right after the other, and then you have to remember, and whatever you did on one, you have to reverse.
Oh, wow. Interesting.
You have to work through a mirror.
Wow.
Okay. And I've done about 6. It's very interesting. I mean, I love it. I've done like 6 sets of identical twins in my career.
Interesting.
Okay. And I love it. It's a little bit nerve-wracking, okay, because you want them to both look the same. And that's the story with identical twins. But I've operated, I'm flattered to say I've operated on a lot of doctors' children, and which is for me a great compliment, because when other doctors trust you with their children, that's a real
that
compliment.
speaks volumes. Yeah. Amazing.
And I enjoy it. I enjoy it. I mean, like I said, the operating room is my favorite place to be.
So I found this thing called the 5-minute nose job using filler. I'm curious, what's the story with that, and who's a good candidate for that? What's the reality of a 5-minute nose job?
I do fillers. I do what we call the liquid rhinoplasty. Okay, what you do is with fillers, you camouflage the irregularities or deformities. If you have a hump and you fill the bridge a little bit, you can make the nose look straighter. If the nose looks droopy, you can bring out the angle and elevate the tip. If they want a little bit more definition in the tip, you can put drops of filler and try to make it look. It doesn't make the nose smaller. It won't make the nose thinner. It'll just camouflage whatever irregularities or asymmetries that there may be. All the patients that I do liquid rhinoplasty on eventually have their nose done.
Really? So this is just a short-term fix, kind of Band-Aid situation?
They're usually afraid of surgery. They're afraid that it might not turn out right. They would rather deal with something that's temporary. The fillers are temporary.
Okay.
They eventually, they dissolve or get absorbed under the skin. And
you have to keep that up, right?
Yeah. They have to be done like, I don't know, every 6 months, once a year, once every 8 months, something like that. You add to the filler. And I do that. Eventually, those patients come to me for rhinoplasty. Some patients, they just really don't ever want to have surgery. They're happy with it. It's okay with me. I can do it. I do it too. And it's a relatively safe procedure. And it just, within a few minutes, you're right. You can
Easy.
You inject it and you can.
It sounds great. A 5-minute nose job is very, very catchy, very catchy. But a 5-minute nose job, you need to get done every couple months.
Yeah,
couple times a year.
As long as the filler lasts, and it depends on which filler you use, and
And again, I'm sure technique.
It's technique. I do it. Okay, I don't have a lot. I myself don't have a lot of patients. Most of my patients come to me for surgery. Okay, because that's what I'm known for. But if they want just the liquid rhinoplasty, we can do that too.
Okay. So we've been talking a lot about going under the blade, the procedures. but there's an after part to rhinoplasty. You have to recover from the nose job. Like any surgery, you're gonna have downtime. What are some realistic expectations of recovery? What does this look like? What can someone do to really wrap their head around the recovery process from post-op swelling to the final results?
Well, in my hand, unless it's a really badly fractured nose or it's a revision rhinoplasty, most of my patients, they heal. The initial healing process is 1 week. We do the surgery as an outpatient. They come in the morning. I do the surgery. They go home the same day. Most of my rhinoplasties, 99% of my rhinoplasties are closed. I operate through the 2 nostrils. Mm-hmm. There's no cutting or stitches on the outside. When they wake up from surgery, they're going to have 2 little tampons. I don't use yards and yards of gauze. That's old technique. We use little tampons that are about 1 inch by 1/2 inch by 1/8 of an inch wide, just to absorb any of the old mucus and blood that collects overnight. And then they usually have a triangular shaped bandage or cast on their nose. The morning after surgery, they come in, they see me. I take the tampons out so they can breathe. I clean the nose. I trim the cast if it needs to be trimmed. Then I usually see them on the 3rd day. I see them the day after surgery. I see them every other day for the first week to clean the nose. The stitches inside the nose are dissolvable, but they take 2 weeks to dissolve. In the meantime, the mucus that the nose normally secretes will stick to the stitches, plugs the nose up. Sometimes it stinks. So I see my patients every other day for the first week to clean their nose and check it, make sure it's healing properly. By the end of the week, on the 7th or 8th day, I'll take the cast off, and the nose will still be a little bit swollen. The bruising usually lasts about 3 to 5 days. By the 7th or 8th day, the bruising is gone. Okay, when I take the cast off, the nose is going to be a little bit puffy. It's going to be a little bit swollen.
If it's hanging on longer, does that mean anything? Is that a sign of infection or a bad nose job, or is it just unique to their recovery process?
I see the patients every other day. The patients are covered by, during surgery, covered by IV antibiotics, and postoperatively they're covered by oral antibiotics. But in addition, but the nose is a dirty place. So I see my patients every other day, and I clean the nose so that there is no infection. And I think the last infection I saw was on a revision rhinoplasty from the Philippines, and that was over 20 years ago. Okay, so I haven't had, knock on wood, I haven't had any infections, and I'm very proud of that.
Okay.
But then I follow my patients very closely, and I think all rhinoplasties should be, because they all heal differently. Okay, I can tell which ones are going to bruise. Okay, they're usually men with very thick bones that have had multiple fractures. Okay, boys come in with crooked noses.
Yeah. Okay.
Noses where you also had to do a large functional component plus the cosmetic component, those are going to be swollen more. Okay, men, thicker skin, thicker bones, they're going to get more bruising. 110-pound, 17 or 18-year-old, she's going to, in 1 week, she's going to look terrific. Okay, it takes 1 week to get the bandage off the nose. It takes 1 more week for all the stitches inside to dissolve. So for the first week or 2, I see the patients every other day. I clean it. Sometimes the stitches are dissolved, but they're just sitting there. I clean the nose to make sure that the patient can always breathe well. Okay, not only that, but it's good nasal hygiene. All right, and I follow my noses once a month. The primary nose jobs I follow once a month for a year. The secondary or revision rhinoplasties I often follow more than 1 year, because in the healing process, on a revision rhinoplasty, if I see that the scar tissue from the previous surgery is not conforming the way I want it to do, there are injections and things I can do to make it heal faster heal the way I do it. And I followed these noses 18 months, 2 years, and you can see them change. Revision rhinoplasties the final result will sometimes take longer. Primary rhinoplasties on a young healthy patient, 3 to 6 months, they're going to look great. They're going to look beautiful.
In that 3 to 6 months, you're saying they're going to look great. Now, is that going to be the final set of the nose, or what's the realistic timeline for most people to be like, this is how my nose is really going to look?
Yeah, the realistic time. I mean, the rule of thumb is 1 year.
1 year.
Okay. On revisions, though, it may be longer. So the rule of thumb on a primary rhinoplasty that's never been done before is 1 year. If in the healing process, there's a lot of patients. I see a lot of patients from the Middle East Mediterranean type people, when their skin bruises, okay, their skin will hold that hemosiderin pigment. For some reason, it always goes away, but sometimes it takes up to 12 weeks. If I have a patient like that has a persistent bruise that the nose is healing fine, but for some reason the dark circles under the eyes are not going away, I include blue light therapy, okay, which improves the bruising and the black and blue.
Photobiomodulation therapy.
Yes, and I also have laser. I have the vascular laser, and it hurts a little bit, but not. It's very tolerable. And if you do a little bit of the laser, the bruising will go away overnight.
Wow.
And I also do that with my injections. Some patients, you can do filler and Botox injections, and they will get absolutely no bruising. Some patients will bruise a lot, and I always use the vascular laser and it takes a second. I mean, it's like just a few zaps of this laser, and overnight the bruising will go away. Even on my facelifts, is that if it's more than a week, 10 days, and they're still bruised from the facelift, I do a little bit of the vascular laser on them, and overnight I can get it to go away. And I include that with the therapy. It makes the patients heal faster. It's very safe, and it's very safe.
Yeah, in terms of safety and timeline of recovery, let's say someone wants to they're going for a rhinoplasty, but also maybe a chin augmentation or a little nip here, tuck there kind of thing. Is it better to go in and do multiple things together, or does, like, again, maximizing recovery and like actually to get the aesthetic that you want, do we need to separate these procedures?
I do them all at once, okay? And I think it's more cost effective to do that. And I really don't think in my hands, it doesn't add to the healing time. If they want their nose, their chin, their eyelids, or nose, eyelids, fat grafting, I mean, I do it all at once. It takes 1 week to heal from the nose. It takes 1 week to heal from the eyes or the chin. If you do them together, you're going to heal everything in 1 week. If you do them separately, each one is a separate week.
And you're only going
and a
under
separate
once.
anesthesia.
Yeah.
No, I once I open the operating room, once I bring the anesthesiologist, I want to do whatever's going to make that patient happy, and it's just much more cost effective for the patient, and it's a lot smoother for me. I mean, I like to see the final result right away.
When you look at final results that really make you like just hurt, cringe, like, call it botched, whatever, do you feel more like the responsibility was on the surgeon or the person? Is it someone going in and just making a wild demand and finding the surgeon that will give it to them? Or is it someone going in with just mixed match expectations and improper surgery? Do you feel like the botched job is more on the patient or the surgeon?
You have to talk to the patient. I really feel that the surgeon is the captain of the ship, okay? And if a patient comes to you with an unrealistic demand, if the patient comes to you with unrealistic expectations, if they present you with, they want you to do a procedure or do a surgery that you feel that's not your expertise, okay, the best thing is to refuse. All right, and I've done that. I mean, I'm very good at doing noses, but if the patient comes to me for a hair transplant, I'm not good. I don't do hair transplant. I send them to someone I know who's very good at it. All right.
Can you help rein in their expectations? Let's say, they want to come to you for a nose job, but they just have a wild, crazy expectation, or they want to look like something that you're just going, it's not realistic or even safe. Do you just say no, or do you kind of get them to go, to get on board with another version?
I try to get a feel for it. If I try to manage their expectations, but if they're obstinate, then there's no hope. So then I refuse. Okay? Some patients are amenable. They'll accept the limitations of the procedure. Others, they'll say, yeah, but I know you can do it. When I hear that, they're not listening to what I'm saying. They'll say, yeah, doctor, but you're a magician. I know you can do it. But I'm telling you what the limitations are. Are you going to accept that? Okay. So, like I said, if the patient is accepting, and they'll say, well, yeah, but if I can at least achieve, 50%, or if I can get it just to be a little bit, okay. And yeah, I understand that. All right. But if they're obstinate and they refuse to listen to what I'm saying, and they'll say, yeah, doc, but you've done it for others. I know you can do it for me. Then I back
They're
up.
not them. Yeah.
Yeah. See, so you have to, I always listen to the patient. The patient will tell you. The patient will tell you what their problem is. They'll make their own diagnosis. Just listen to what they're saying. And, like I said, I listen to what they say. If they accept what I'm saying, that's fine. If they don't accept, then there's no hope. If they're going to be obstinate, there's no hope.
Agreed, yeah. Let's talk cost. What is the average cost for a primary rhinoplasty?
Oh, a primary rhinoplasty, it depends on what the, how difficult it is. But, rhinoplasties, there's a range. I mean,
You're talking $5,000, $50,000.
Well, no,
$20,000.
No, I mean, I think the average rhinoplasty in Los Angeles runs around. I mean, you have to say, I'm including the operating room. I'm including the anesthesia. I'm including the preoperative blood tests.
From the first consult to leaving the recovery room.
Yeah, I think the most competent surgeons in town get $15,000 and up.
Okay, and now what about pain? How painful is a nose job?
I think women tolerate rhinoplasty very well. I know what it feels like because I had my nose done years and years and years ago by the professor who taught me how to do noses. And it's not a very painful operation. I mean, the nose is sore. It feels like you got punched in the nose. It feels sore for the first 3 days, and it throbs. After the third day, the pain really subsides. Okay? And, I see my patients walking around the street after the third day with their bandage on their nose.
Yeah, there's no shame. I see people walk around. I'm like, you literally just left the operating room. Like you got it right here. It's so fresh.
One day I stopped at a stop sign. I saw one of my patients walking in the crosswalk with a bandage on her nose. Okay, so, but men are a little bit more sensitive. I hate to say it, but it's
no,
true.
we're babies. Yeah, we get sick.
Men are
We're
a
down
little
for the
bit more
count.
sensitive, but most men tolerate it very well. They do good. Yeah.
Okay. So, kind of getting towards the end here, I want to ask you what advice you might have for anyone feeling insecure about their nose but unsure about surgery.
Well, I think you have to go if you're unconfident, if you considering rhinoplasty, you have to go for multiple consultations. I mean, years ago there weren't that many doctors. Now there's a lot of doctors. I see patients every day. I operate on people every day. They've seen 4, 5, 6 different doctors. They got 5, 6 different opinions. They read the social media. They have friends and relatives who's had it done, and this actually has been studied also. There is medical literature that the average rhinoplasty patient will think about it for 2 years before they actually do it.
Wow.
They'll think about it for 2 years. So it's not a snap decision. And if I have a patient who comes in and who's, hesitant or reticent, or they have second thoughts about whether they should do it or not, I advise them not to make any decisions. They have to go home and think about it. I've done the consultation. Discuss it with your family and friends. Discuss it with whoever has anything to say about what you're going to do, okay? And then when you're ready, you come back and we'll discuss. We'll talk about it again. We'll do the consultation all over again. And, I include that with my initial consultation. I like to see my patients back. I want a patient who's confident. People who are confident, people who are sure of themselves. Patients with positive attitudes are gonna get great results. Okay, and it energizes me. And patients with you walk into the operating room and you're eager. Every day I walk into the OR. When I walk into the operating room, I'm eager to do these cases. I look forward to it. Okay, I get up at 5 o'clock in the morning. I can't wait to get to the operating room, okay, because I'm doing what I like.
That's amazing. That's what we all want. That's what we all want here. Now, this is purely fictional, but I want to tie in like a timely event. Did you ever watch the show Nip Tuck?
Yeah, I've watched it.
So one of the main characters, one of the plastic surgeons on there, he just passed away from cancer, actually. I think Julian McMahon. He was Christian, one of the doctors on there. I think he was only at the age of 56, but I love that show, and it was so, like, honestly, it was pretty graphic, but it was like so believable to the procedures they were doing. I really felt like the world lost an amazing plastic surgeon, but it was all just fictional. But he, great actor in a lot of other Marvel movies and stuff too. So definitely a loss for sure. But no one really got a nose job from him. But I was just curious if doctors actually watch the stuff that's out there, fictional or like Botched or.
Well, I don't watch it regularly,
or,
but I know it's out there because I have to respond to the patients. Okay.
Does pop culture really influence your patients that much? Are people coming to you with like, I saw this on Nip Tuck, I saw this on, Real Housewives or whatever? Is that really influencing?
Yeah. I don't think it influences them, but they ask me about it. You have to be wary of the patient that's over influenced by the media. There's a lot of, it's a lot of it out there has been overdone, oversold. Okay, so I think you have to be weary with a patient who's oversold, who's into that. They want to look like that person, or they want to go on TV.
Yeah.
So I'm always very hesitant, and I think that's where I try to manage their expectations.
The sign of a great doctor, the sign of a great coach. We all can want whatever we want. That's amazing. But especially when we're going to be putting potentially, our health on the line, we want someone like yourself to manage expectations and really go, here's the best thing for you. And after that, it's going to be, how can I help you with adherence for the recovery process, for maintaining this new look and feel and confidence level, because it's more than just a nose job, right? People are walking out and having their lives changed. So that's not just a one and done procedure. That's for the rest of your life.
Well, thank you. I mean, you've asked some very thought-provoking questions.
Well, thank you.
And
Thank you.
intriguing.
It's clear that you're very passionate
and
and very experienced in what you do. And to wrap it all up, I always ask my guests the last question, the same question, is now that we've understood what you do and how you do it, I want to have you think about that through the main mantra of the show. It's all meant to bring on experts and guests and people that just highlight a unique area of well-being so that I can learn how to, and my audience can learn how to move forward and in a unique area or all areas of our well-being. So to live a life ever forward, if I were just to ask you directly, what does that mean to you, ever forward, those two words?
Ever forward? Mm-hmm. It's how I live my life. I mean, it's your purpose in life, why I'm here. Okay, I was brought into this world to take care of people, to make people feel good. I like to please people. Okay, I like to see them smile at me, and I really feel that I've achieved that in my life because I've done generations of patients now. Okay. And every week I get bouquets of flowers or boxes of chocolates, and I want to do this forever.
I think we all would want to strive for that, whatever we're doing. I think it's a great way to describe living a life ever forward is loving what you do so that you can want to do it forever, or even just having that zest for whatever you're doing. It might not be the same thing always, but just always being able to be in love with what you're doing is definitely going to advance you forward in life.
I enjoy it.
Dr. Chobanian, this was fantastic. Thank you so much.
Thank you.
Where can my audience go to connect directly with you, learn more about your content, any book, any courses, or maybe book a consult?
Yeah, no, it would be my pleasure. I'm in Glendale. I'm in Los Angeles.
Roll through,
I'm on
everybody.
social media.
Yeah.
I'm in social media.
Well,
I'm on Instagram. I'm on Facebook.
We'll have all of that in the.
You're welcome to look me up anytime.
We'll have it one-stop shop for everybody in the show
Susan
notes and video
Chobanian.
description.
Yeah.
We'll have it down there for you guys. Thank
Susan
you so much.
Chobanian, MD. I'm the
All
queen
right.
of rhinoplasty. Thank you for having me.
My pleasure.